Colon cancer is one of the most common cancers in the United States. And though the recommendation is that those around the age of 50 should get screened, doctors are now advising people even younger get a colon cancer screening. We sat down with gastroenterologist Dr. Abhishek Gulati, who shares with us a disturbing new trend he's noticed in his own practice of younger patients getting diagnosed with colon cancer.
For, I think, about 5 to 10 years, we've been noticing a trend of increasing incidence of colon cancer in relatively younger patients as opposed to what has traditionally been offered in terms of age. 50 years is considered to be the age where we should offer colon cancer screening to average risk population. But now we're seeing that almost 10 to 11% of the cases of colon cancer happen in people under the age of 50. So when the initial guidelines, this was way back in the 90s, when the initial guidelines for colon cancer screening were offered as a screening tool nationally, the age at which they saw there was a considerable increase in risk was around 50 years. And age is an important risk factor. But in the last 10 years, I'd say in my own practice, also I've seen relatively younger patients, even younger than 40 years, who've been diagnosed with colon cancer. Colon cancer is one of the most common cancers in the United States. And the good thing is it's preventable. So number one message that I try to get across to my patients is don't discount symptoms related to your GI tract. Don't assume the bleeding is from hemorrhoids. Don't assume the pain, especially if it's persistent and it's been going on for weeks, is something that may have been that you ate. Don't make assumptions. Age is one of the most important risk factors. That's why we consider. So the highest incidence, I'd say, is probably in the ages of 60 to 75. But the inflection point as such traditionally was thought to be around 50 years. But now, like I said, 40 is considered to be the new 50. Other risk factors, really, genetics plays a big role. We do know if you have family history of colon cancer in a first-degree relative or in multiple second-degree relatives, that's a risk factor. Our Western diet and lifestyle, with being more sedentary, obesity, that's considered to be a risk factor, smoking, heavy alcohol consumption, those are all considered risk factors. If you're in the right age, where you need to be screened for colon cancer, you should ask about your options to get screened. There is more than just colonoscopy now. And that's number one. And number two, like I said, if there are symptoms that are new, concerning, and persistent, especially like abdominal pain, change in bowel habits, if you're having rectal bleeding, weight loss that's unexplained, those would be reasons I would talk to your primary care physician about whether or not this is something you should consider getting a colonoscopy for. Colon cancer screening is easily available. There are different options to get screening done. And if you have symptoms, especially, don't ignore them. Unfortunately, colon cancer is not a disease that is restricted only to people over the age of 50. Like I mentioned, 11% of the cases happen in people 40 to 50.